And right now, a new weapon in the war on obesity. The FDA recently approving a procedure that some think could revolutionize the battle of the bulge. It places a balloon in the stomach through the mouth, so it's not surgical like gastric bypass. The balloon is inflated with saline, making patients feel full faster. And the procedure is available to folks who have as little as 20 pounds to lose. Joining me now is Dennis McWilliams, the president of Apollo Endosurgery. I'm so glad you're here today because I've seen a lot of ads for this and I've read about it, so I'm so interested to see it in person and ask you questions. First of all, so it goes into your stomach, it fills up. How long can you have it, and what are the results like? The
balloon is left in for 6 months. It's a non-surgical procedure, as you mentioned. And after it's inserted, the patient starts a monitored diet and exercise program, which will last for a 12-month period. But after 6 months, the physician goes back down, removes the fluid from the device, and takes the balloon out.
Are you unconscious when they do that?
They do.
Oh, thank goodness.
Right.
And this is appropriate for people because I know a lot of times when people go for lap band or gastric bypass, there's a big hurdle. You know, you have to be severely overweight. And this seems to address that area where, you know, Jenny Craig might not do it for you, but you don't qualify for the other.
In the past 15 years, there hasn't been a new weight loss device approved by the FDA. And so, you know, there's been a really big gap between diet and exercise in very invasive surgery. And so what Orbera is meant to do is to fill that gap, give people options so that they don't have to go have a very invasive surgical procedure to avoid and lose the weight.
And what's the success rate like? What can you expect?
You know, most patients have great success with the product. In our clinical studies, patients lost anywhere from 20 to 40 pounds, about 3 times the amount of weight they would lose from simple diet and exercise alone.
So 20 to 40 pounds in about 6 months. That's what you're looking at. That's average?
That's average. Some people do a lot better than that. And so it just really depends a lot of times on how committed the patient is to the program.
Yeah. We see the balloon in your hand right there, and I held it before. It's quite heavy. I mean, is that the size it would be in everybody, or it just depends on?
No, they adjust the volume that they fill it based on the size of the patient and the anatomy of that patient. But
so with all of these things, it's benefit versus risk. What's the risk? I mean, what's the worst thing that could possibly happen to me?
No, mostly what happens with balloons, the patients will experience a small amount of nausea for the first few days, but that typically resolves. And since it's a non-surgical procedure, if there ever were a problem, it's very simple to go in endoscopically and remove the device.
Has it ever burst on you?
No, the leak rate is no. These things, they're very durable, as you can see, and so the leak rate is extremely small, and if there ever were a problem, it's very simple to remove endoscopically.
Wow. Here, let me see.
Sure.
Yeah, it obviously weighs a lot. This is really interesting. So one of the other big features is qualifying for insurance. Obviously, you know, when people go in, they try to see what is your BMI to see if you qualify. What does this cost, and is it hard to qualify to get your insurance to pay for it?
So right now, since it's so new, it's not typically covered by insurance. So, you know, patients typically will pay out of pocket for that. Cost ranges anywhere from $6,000 to $8,000 for the 12-month program. But, you know, I think over time, as, you know, people realize the benefit of patients losing weight, the impact that can have, that, you know, we do think insurance companies will, over time, do that. I mean, this has been used in over 220,000 patients around the world, and in many countries, it is reimbursed, and so we just think it's a matter of time.
How many in the U.S. so far?
We've trained around 500 physicians, and we've done a few thousand cases in the United States.
Thank you so much. We're out of time. I appreciate it. Neat stuff. Good for you.